Well, experts say racial disparities and tensions, along with mass shootings and the pandemic, they've had a major impact on the mental health of minority teens.
Yeah, Dr. Evita Limon Rocha is a psychiatrist with Kaiser Permanente, and you work with children, adolescents, and adults. And she's here to talk about the challenges for minority teens and how adults can actually help. Thanks so much for joining us, Doctor.
It's an honor. Thank you.
Now, what are some of the challenges minority youth face in seeking mental health treatment?
So I think stigma is huge. Feeling afraid to seek help, to kind of feel, even recognize is a big issue for kind of all communities, especially Latino and minority communities.
Yeah, doctor, let's talk a little bit about your thoughts when it comes to increased depression, anxiety as well in youth in underserved communities. What are some of the signs that we see when it comes to that?
Definitely. So I think one of the things I like to talk about is normalizing emotions. Just like you mentioned, there's so much that has happened. COVID, the pandemic, all the different shootings that have occurred most recently this weekend. And it's important to recognize that we all have an emotional response that's normal, but mental health, we have to start considering that when it starts affecting our daily lives in terms of children and adolescents, academics kind of dropping, plummeting, children not wanting to get out of bed because they're just so tired, or alterations in sleep, appetite, irritability, spending more time alone and away from the family. Those are all different things that we can recognize.
And what can parents do to help with their teens and know when it's really time to get the professional help?
Right. So I think the first thing is recognition, in that a lot of times we as a society are very kind of attached to our telephones, attached to electronics. So taking that time away from electronics, if we're possible, eating dinner as a family together, so that we're better able to recognize there's a change in my daughter, there's a change in my son, they're isolating, their grades are dropping, and also to kind of work on that relationship. Who is my son right now? Who is my daughter right now? What do they like to do? What are their interests? And investing in that relationship, because even as a parent, we have to invest in those relationships to be able to recognize those changes.
Yeah, and doctor, talking a little bit about normalizing emotions, I have teenage nieces and nephews, you have teenage boys.
Yes.
How do you get kids to normalize their emotions and to communicate and express what they're feeling? Because oftentimes when they get to that age, they're shut off and they don't want to talk about anything. So as a parent, what can they do?
So as a parent, modeling good behaviors. So kind of saying, like, if we're feeling happy, I'm really happy, or that was really tough. And setting that time aside. So say that if there was a new segment that the family watched together, setting kind of time aside closely afterwards, let's talk about this. That seemed pretty scary. So modeling kind of those behaviors that, yes, it's okay to feel emotions, and let's talk about those emotions in a safe way.
All right, doctor.
And showing that love.
Yes, absolutely.
That's what I do with my nephews. Just show them that love, tell them I love you, congratulate them on things, and just tell them you're proud of them for the little things.
Keep the lines of communication open. That was also key.
I love that.
All right. Thank you so much, doctor. We appreciate your time this morning.
It was a pleasure. Thank you so much. Have a wonderful day.
You're awesome.